co-chairmans of this occasion, Dr. S. Marvel, former medical superintendent of Base Hospital, Chavacheri, and Dr. T. Kandiban, the present medical superintendent of Base Hospital, Chavacheri. The chief guest of the occasion, His Excellency Eric Walls, High Commissioner of Canada to Sri Lanka. Special guest, Dr. Saman Patirana, the Provincial Director of Health Services, Northern Province, and Mr. T. Sendil Kumaran, the Sendil Kumaran's Relief Agency, Canada. Our guest of honor, Dr. Brahma, the consultant nephrologist from Teaching Hospital, Jaffna, and also our acting medical superintendent, Dr. Tishani Seralathan, and also our DMO, Varani Hospital, Dr. Achyutan, our consultants, and the staff of this hospital, the members of the Patient Welfare Society, Base Hospital, Chavacheri, and also the members of the Marathi Development Association, media. Good morning to everybody. It's a great pleasure and privilege for me to be present at the occasion of handing over this dialysis mission to Base Hospital, Chavacheri by the Sendil Kumaran's Relief Agency, Canada. It is my duty to express our gratitude on behalf of people of Jaffna district as well as on behalf of the Health Department of Jaffna to Mr. Sendil Kumaran for your generous donation. I know him, he carries out a lot of this kind of supporting projects in Northern Province for several years. I think soon after the war, I met him in Canada personally, and I think he was supporting a lot of patients for cardiac surgeries. I think recently in the Teaching Hospital Jaffna, they have opened a unit. He was supporting to establish a cardiac surgery in Teaching Hospital Jaffna. Thank you very much on behalf of the people of Jaffna district. And also it is my duty to extend our gratitude to His Excellency Ambassador, High Commissioner for gracing this occasion on our invitation. This week is a very remarkable week for Base Hospital, Chavacheri. Last Tuesday, we have opened a new blood bank for this hospital. It will be a milestone in the history of this hospital. And today, we are getting 2 dialysis machines to this hospital. In fact, this dialysis unit was actually modified with the help of the IMHO USA. They contributed. And we have received the backup generator, standby generator 400 kVA in Colombo. I think very soon we are starting to put up the generator platform and room. I hope within 1 month time we will be able to install that generator and establish the standby power supply for this building, accident emergency unit building. So after that, I think we are planning to shift the dialysis unit to this new unit. As Dr. Kumara will mentioned, we can have 6 machines. We can run this unit with 6 machines. Dr. Brahma is here. He knows in Jaffna district, actually not only in Jaffna district, even entire Northern Province, the number of dialysis, the patients with chronic kidney failure in increase. The prevalence is in the increase. So in Jaffna district also, we observe the increasing trend of number of chronic kidney disease patients. In Jaffna, we have 4 hospitals with the dialysis machines, unit facilities, Teaching Hospital Jaffna, Base Hospitals, Tellipala, Coimbatore, and Chavacheri. But still, the demand, we are unable to cater the demand and the need of the patients to give a satisfactory or optimum care for these patients. So it is our duty to strengthen and expand the services of the dialysis units in Jaffna district. I think Dr. Brahma, consultant nephrologist, he will explain in his speech. We have to, I think he has his own plans how to expand the Teaching Hospital Jaffna. And I think from in Point V2 with the Netherlands project also, we are getting a new dialysis unit. So it is our duty, it's a time, the need to expand the services for the chronic kidney patients not only in Jaffna district as well as in the entire Northern Province. So today it's a remarkable day, and also last Monday, I think, with the new provincial director of health services, he visited this hospital, and we had a very fruitful discussion how to improve the service delivery of this hospital. We know this hospital during the wartime, this hospital was completely destroyed up to the ground level. And since 2005, we started to slowly reconstruct this hospital, and today we have brought up this hospital to this level. But this area, there's a lot of people depend on this area. Most of the people are very poor. So we have to deliver and establish the services for the people of this region. So we are committed, and definitely we will extend our support to improve the services of this hospital. And also, once again, I would like to thank the Central Kumaran Regency for your support. And then very soon we will ship this dialysis unit, and the people of this area will be benefited from this donation. Thank you.
Vanakkam. Senthil Kumaran, I think without you, we simply wouldn't be here today. So thank you for making this happen. Thank you for bringing all of us together on this wonderful occasion. Dr. Patirana, it's great that you could be here today. Dr. Keteswaran as well. Dr. Kandipan, what a wonderful way to spend your last period in this space hospital, celebrating this momentous event. Dr. Tangaraja, I've heard wonderful things about you, and I saw in your words the passion that you bring to healthcare, which is so critical for successful outcomes. It's really a pleasure for me to be here today to see the culmination of this effort to bring these dialysis machines here. I recognize maybe this is one small step in improving healthcare outcomes in Chalacheri in Northern Province, but every step is an important step, and it's important to celebrate them when we can. This donation, made possible by Senthil Kumaran and other donors in Canada, will greatly enhance the medical outcomes for renal patients, and medical staff will be able to treat them more effectively, and I think hopefully be a little less stressed in their day-to-day lives. For all the doctors here today, all of the nurses here today, all of the patients here today, I just wanted to say thank you for taking time. I won't take too long because I think many of you may have to get back to saving people's lives. But I did want to congratulate Senthil Kumaran and the whole team behind him for the tireless efforts in raising funds from the community in Canada to support purchasing this equipment. And of course, many of you and many of the doctors here at the head table have spent a lot of time and resources to make this initiative a success as well. This initiative is very much aligned with Canadian values, our sense that people and nations have become ever more interdependent. We see so many Canadians, especially with origins here in Sri Lanka, looking to see how they can contribute to making people's lives better here in this country. And it's a tremendous reflection of the strong bonds that connect Canadians and Sri Lankans, and the role that the diaspora community in Canada can play in contributing to Sri Lanka's development. So we at the High Commission of Canada, it's a real privilege for me to be here today to extend our support to all of you. Your commitment and your compassion are deeply appreciated. Together, we're making strides for a healthier future in this province and in this country. Let us continue to work hand in hand to save people's lives and foster a brighter future going forward. Thank you. Nandri.